November is the month for awareness of gastric cancers, pancreatic cancers and lung cancers. So आज चाहिँ म pancreatic cancer को बारेमा अलिकति भन्छु. So I am Dr. Saptarshi Ghosh. I am a consultant clinical oncologist from Hope and Heal Cancer Hospital and Research Center, Jotiakali Mode, Fulbari. Pancreatic cancers are generally a very bad type of disease. So यो cancers चाहिँ they are very slow, silent killers, you can say. So they don't symptomatically express themselves. भन्नाले सुरुमा चाहिँ त्यस्तो थाहा हुँदैन. So the symptoms and signs of pancreatic cancers may be त्यो अलिक ग्यास्ट्राइटिस जस्तै हुने, हार्टबर्न जस्तो हुने हैन, ग्यासको एउटा प्रब्लम हुन सक्छ, पेटमा दुख्न सक्छ, ढाडमा दुख्न सक्छ. सो इट्स टिपिकली द पेन गोज टु द ब्याक साइड अफ द बडी. सो यस्तोहरू चाहिँ अर्ली साइन्स एन्ड सिम्पटम्स हुन्छ. तर टु डिटेक्ट pancreatic cancers in early stage, I would request everyone to have regular checkup with the local physicians, a whole body checkup ma janu, ultrasound garaunu. So these things generally pick up these pancreatic cancers in early stage. And the persons who are at risk are always the alcohol abuse and all these people with some tobacco use, alcohol abuse. These are the risk factors. These are very important risk factors for pancreatic cancers, and like all cancers, these should be avoided. So यसमा चाहिँ कस्तो हुन्छ भन्दाखेरि pancreatic cancer does have a familial connection also. BRCA mutation or mutation पनि pancreatic cancers देखिन्छ. So it may run in family in very few patients, very less percentage of patients. So how is pancreatic cancer diagnosed? Generally they are picked up with patients who have a severe back pain or abdominal pain, vomiting हुनु थाल्छ. त्यसपछि हामीले टेस्ट गर्दाखेरि थाहा हुन्छ. And then first we do a biopsy, ultrasound guided biopsy most of the times. So biopsy गरेर त्यसपछि we do an immunohistochemistry to know to confirm the diagnosis that it's a pancreatic adenocarcinoma. Pancreatic cancers can be of different types, so it may be an adenocarcinoma, it may be something else. So these things has to be always confirmed with immunohistochemistry report. And pancreatic cancers मा चाहिँ एउटा NGS testing गर्छ generally to find out if there are any targets available or not, especially in advanced pancreatic cancers where it has spread. So in general, pancreatic cancers are bad cancers, so we have to go for surgery first if operable. Operable भयो भने यो चाहिँ सुरुमै सर्जरी गर्न बेस्ट, that's the best way to go about it. And surgery पछि chemotherapy हुन्छ. So but the thing is that the pancreatic cancer एकदम localized हुनु पर्यो. So we generally do a PET CT or an MRI abdomen to see whether it's localized or not, whether it's operable or not. So localized pancreatic cancer or टाढा ठाउँमा फैलिएको छैन भने, and if it has not त्यो रक्तनाली जान्छ पेटमा, त्यो रक्तनालीमा एकदम टाँसेको छैन भने त्यो एकदम क्राइटेरिया छ एउटा operability को. So if it looks operable and if it has not spread to anywhere else, then the best treatment is surgery first, followed by some form of chemotherapy. Generally we give 6 months of chemotherapy. So the best chemotherapy regime which is there at present is FOLFIRINOX. The FOLFIRINOX is a little difficult to take for many patients. So the alternative regime which we might give is gemcitabine and capecitabine tablet huncha, the gemcitabine injection huncha. That may also be given for 6 months. So that's the thing with upfront operable pancreatic cancers. Now for the patients who जसलाई हामीले एमआरआईहरू गर्दाखेरि देखे के लाइक के त सिटी स्क्यान गर्दाखेरि हामीले देखे के त्यो रक्तनालीसँग टाँसेको छ, it doesn't look like upfront operable हुन्छ त्यस्तोमा. So त्यस्तोमा के गर्छ भन्दाखेरि we first give 3 months of chemotherapy and hope for the best result. So in those cases FOLFIRINOX again is a very good option जुन हामी दिन्छौँ. And apart from FOLFIRINOX, then we give GEM or nab-paclitaxel भन्ने एउटा injection हुन्छ. So these types of chemotherapy does work very good in pancreatic cancer. So but the response rate is not always very good. So once it's borderline operable, we give 3 months of chemotherapy पहिला, and then we again assess the response. Operable भयो भने operable surgery मा जान्छ. That's the best treatment we know. and followed by some post-op chemotherapy again. तर operable भएन भने चाहिँ it goes to radiation therapy sometimes, and generally 25 to 28 radiations are given, and followed by that again हामीले response assess गर्छु कि कतिको के घट्यो, त्यसमाथि हामी विचार गर्छु कि operation हुन्छ कि हुँदैन. So basic thing about pancreatic cancers are we are trying to find out different ways to take the patient for surgery, either upfront or if upfront operable छैन भने पहिला chemotherapy दिएर रेडिएसन दिएर रिड्युस गरेर त्यसपछि लिएर जान खोज्छु. नाउ द वर्स्ट पार्ट इज द मेटास्टेटिक प्याङ्क्रिएटिक क्यान्सर्स, जुन प्याङ्क्रिएटिक क्यान्सर पुरै फैलिसकेको छ, स्टेज 4 डिजिज. सो यसमा चाहिँ प्रोग्नोसिस इज रियली ब्याड. सो द एभरेज सर्भाइभल इन सच पेसेन्ट्स इज अराउन्ड 6 to 12 months. फल्फिरिनक्स केमो इज अगेन द बेस्ट केमो रेजिम विच इज एभाइलेबल. यो केमोहरू चाहिँ 2 हप्तामा हुन्छ, provided the cardiac status is good. So cardiology opinion is must before we start 5FU based chemotherapy. 5FU चाहिँ अलिक ischemic heart disease मा चाहिँ contraindicated छ, so we have to check that. And त्यसपछि चाहिँ फल्फिरिनक्स चाहिँ 3 दिनको केमो हुन्छ. मोस्टली इट्स टेकन इन बेलुन पम्प. इट्स बेटर टु अलवेज गो फर ए पिक लाइन. पिक लाइन भन्ने एउटा यो यहाँ एउटा हातमा चाहिँ एउटा च्यानल गरिराख्छ, त्यो चाहिँ ड्रेसिङ गरेर राख्छ, त्यहीँबाट हरेक टाइम केमो हुन्छ. सो त्यो च्यानल गरेको जुन हुन्छ पिक लाइन जुन हुन्छ त्यो लिएरै मान्छे घर जान्छ, छुट्टीमा घर जान्छ, त्यसमा केही हुँदैन. त्यो भयो भने चाहिँ हातमा घाउ हुने चान्सेस एकदमै कम्ती हुन्छ. सो हातमा घाउ हुँदैन. त्यो गरेन भने चाहिँ हातमा घाउ हुने चान्सेस एकदम बढी हुन्छ. सो आई वुड सजेस्ट एभ्री वान टु गो फर द पिक लाइन बेस्ड केमोथेरापी, or he or she may also go for chemoport insertion followed by chemotherapy. Otherwise there will be severe thrombophlebitis and त्यो हातहरुमा त्यो veins-हरु पुरा एकदम खराब हुन्छ. So we give 12 cycles of FOLFIRINOX. First 6 cycles दिएर त्यसपछि हामीले फेरि response assess गरेर then 6 more cycles. Similarly with GEM and nab-paclitaxel we give 3 months of therapy first and then again reassess के कतिको के response भयो. Response राम्रो छ भने we give again 6 more cycles. Many a times pancreatic cancers patients मा चाहिँ एकदम फैलिसकेको हुन्छ and patient status is not that good to take up chemotherapy. So त्यस्तो पेशेन्टमा चाहिँ best supportive care is an option. And यसमा चाहिँ हामीले pain control is a very important subject. So we should always go for pain control, adequate pain control, because these are really painful cancers. And we should always go for opioids like morphine, fentanyl यस्तोहरू लाग्छ. And some people may go for celiac plexus block and all these things. So pain control is very important in pancreatic cancers because the quality of life deteriorates otherwise. So हामीले त्यही भन्छु कि like always be in regular touch with your local physician for general body checkup, for blood tests and ultrasounds and x-rays whenever it's indicated. So thank you so much. Namaste.